Hello everybody, this is Adawadullah speaking. Today we will talk about sulfonamides, trimethoprim and quinolones antibiotics. Sulfonamide group belong to antibiotics called antifolate drugs. Sulfonamide is a basic formula of them and their structure is similarly to para-aminobenzoic acid which is called PAPA. Sulfonamides with varying physical and chemical and pharmacological and antibacterial properties produced by attaching substituents to the amide group, which is SO2 attached to NH attached to R subunits, or substitute attached to amine group, which is NH2 of this sulfanilamide nucleus. Sulfonamides tend to be much more soluble at alkaline than an acidic pH. Most of them can be prepared as sodium salts, which are used for intravenous administration. When we talk about mechanism of action and antimicrobial activity, sulfonamide susceptible organism, unlike mammals, cannot use exogenous folate, but must synthesize it from para-aminobenzoic acid, which is called PAPA. This synthesis of this pathway is thus essential for production of purine and nucleic acid synthesis. And sulfonamide لأنها بتشبه البابا structural analogs of PAPA, sulfonamide inhibit dihydropyruvate synthase enzyme and thus inhibit folate production. Sulfonamides inhibit both gram-positive bacteria such as Staphylococcus species, gram-negative enteric bacteria such as Escherichia coli, Klebsiella pneumonia, Salmonella, Shigella, Enterobacter species, as well as Nocardia species, Chlamydia trachomatis, and some types of protozoa. Combination of sulfonamide with an inhibitor of dihydrofolate reductase, either trimethoprim or pyrimethamine, provides synergistic activity because of sequential inhibition of folate synthesis. لأنه كده السلفوناميد هتعمل inhibition لأساس بتاع الفولات، في نفس الوقت هنلقى إنه as في sequential inhibition due to inhibition of trimethoprim والpyrimethamine زي ما هنشوفهم لقدام. Resistance to a sulfonamide. Some bacteria like the enzyme required for folate synthesis from PAPA, and like mammals depend on exogenous sources of folate, therefore they are not susceptible to sulfonamides. Other types of bacteria resistance can occur as a result of mutation. Number one, cause overproduction of para-aminobenzoic acid. Number two, because of production of a folic acid synthesizing enzymes that has low affinity for sulfonamides. Number three, impaired permeability to sulfonamides. Pharmacokinetic, sulfonamide divided into three major groups: oral absorbable, number two oral non-absorbable, number three topical sulfonamides. Oral absorbable sulfonamide absorbed from the stomach and small intestine, distributed widely to tissues or body fluids, including central nervous system and cerebrospinal fluid, placenta and fetus. Protein binding varies from 20 to over 90%. When we come to clinical uses of sulfonamides used as a single agents, many strains of formerly susceptible species, including meningococci, pneumococci, streptococci, staphylococci, goenococci, are now resistant. But the fixed drug combination of trimethoprim-sulfamethoxazole is the drug of choice for infections such as pneumocystis jirovecii. Formerly زمان كان بيسموها pneumocystis carinii, which causes pneumonia. And fixed combination also useful for toxoplasmosis and also useful for nocardiosis. When we came to clinical uses of an oral absorbable agent, administration of sulfadiazine with pyrimethamine first-line therapy for treatment of acute toxoplasmosis. In some cases, clinicians have obtained a compounded product through specialty pharmacies or prescribed alternate agents such as Trimethoprim-sulfamethoxazole, sulfadioxine, long-acting sulfonamide that is co-formulated with pyrimethamine, called Fansidab, used for a treatment of second line for a treatment for malaria. The second group, which is oral non-absorbable agent sulfasalazine, is widely used in ulcerative colitis, widely used in enteritis, and other inflammatory bowel disease. When we came to the third group, which is topical agent, sodium sulfacetamide, ophthalmic solution or ointment, effective in the treatment of a bacterial conjunctivitis and as adjunctive therapy for treatment of trachoma. Another sulfonamide, which is called mafenide acetate, is used topically but can be absorbed from alpine sites. When we came to side effects of a sulfonamides, drug containing sulfonamides moiety, including antimicrobial sulfurs, diuretics, diazoxide, and the sulfonylurea hypoglycemic agent, were considered to be cross-allergenic. The most common adverse effects are fever, skin rashes, exfoliative dermatitis, photosensitivity, urticaria, nausea, vomiting, diarrhea, and difficulties reversible to urinary tract. In some cases, Stevens-Johnson syndrome, relatively uncommon, less than 1% of treatment courses, is particularly serious and potentially fatal type of skin and mucous membrane eruption associated with the sulfonamide use. Other unwanted effects include stomatitis, conjunctivitis, arthritis, hematopoietic disturbances, hepatitis, and rarely polyarteritis nodosa, and plus a psychosis. The second group, which is trimethoprim and trimethoprim-sulfamethoxazole compound or mixture. Trimethoprim selectively inhibited bacterial dihydrofolic acid reductase, which converted dihydrofolic acid to tetrahydrofolic acid, a step leading to synthesis of purines and ultimately synthesis of DNA. Trimethoprim is much less efficient inhibitor of mammalian dihydrofolic acid reductase. ما بيعمل inhibition للمامل enzymes. The combination of trimethoprim with sulfamethoxazole is often bactericidal compared with the bacteriostatic activity of a sulfonamide alone. Clinical uses: oral trimethoprim can be given alone 100 mg twice daily in acute urinary tract infection. Many community-acquired organisms are susceptible to the high concentration that are found in the urine. The second clinical use is oral trimethoprim-sulfamethoxazole. The combination that is effective for a treatment of Pseudomonas jirovecii pneumonia, urinary tract infection, prostatitis, and some infection caused by susceptible strains of Shigella, Salmonella, and non-tuberculous mycobacteria. It is active against most Staph aureus strains, both methicillin susceptible and methicillin resistant, and against respiratory tract pathogens such as Haemophilus species, Moraxella catarrhalis, and Klebsiella pneumonia, but not Mycoplasma pneumonia. Number 3. Oral pyrimethamine with the sulfonamides. Pyrimethamine and sulfadiazine used for the treatment of a toxoplasmosis. The dose of sulfadiazine is 1 to 1.5 gram 4 times daily, with pyrimethamine given as 200 mg loading doses, followed by a once daily dose of 50 to 75 mg. In falciparum malaria, the combination of pyrimethamine with Doxine, which is called commercially Fansidar, has been used. Side effect of Trimethoprim: produce adverse effect of an antifolate drug, especially megaloblastic anemia, leukopenia, and granulocytopenia. The combination trimethoprim-sulfamethoxazole may cause all of the unwanted reaction associated with the sulfonamides. Nausea, vomiting, drug fever, vasculitis, renal damage, and sinus disturbances can occur. Trimethoprim inhibit the secretion of creatinine at the distal renal tubule, resulting in mild elevation in serum creatinine without impairment of glomerular filtration rate. Secondly, we will talk about fluoroquinolones. This drug called DNA gyrase inhibitors. They inhibit enzyme called DNA gyrase. The clinically relevant quinolones are synthetic fluorinated analog of naldexic acid. They are active against a variety of gram-positive, gram-negative bacteria. Quinolones block bacterial DNA synthesis by inhibiting two types of enzyme: topoisomerase 2, which is called DNA gyrase enzyme, and topoisomerase 4. This lead to inhibition of a DNA synthesis. Inhibition of DNA gyrase prevent a relaxation of positively supercoiled DNA that is required for normal transcription and replication. هيعمل inhibition لانه يحصل relaxation للDNA الملفوف لما نيجي يحصل اللي هو تكاثر. Inhibition of topoisomerase 4 interfere with the separation of a replicated chromosomal DNA into the respective daughter cells during cell divisions. Fluoroquinolones have excellent activity against gram-negative aerobic bacteria versus gram-positive. Norfloxacin is the least active fluoroquinolones against both gram-negative and gram-negative, with minimum inhibitory concentration 4-fold, 4 to 8-fold higher than those of ciprofloxacin. Ciprofloxacin, enoxacin, lomifloxacin, levofloxacin, and ofloxacin, and lbfloxacin comprise a second group of similar agents possessing excellent gram-negative activity and moderate to good against gram-positive bacteria. Gatifloxacin, gemifloxacin, and moxifloxacin make up a third group of fluoroquinolones with improved activity against gram-positive organisms, particularly pneumonia and staphylococci, streptococci pneumonia and staphylococci. Gemifloxacin is active in vitro against ciprofloxacin resistant strains of pneumonia, but in vivo efficacy is unproven. Fluoroquinolones also are active against agents of atypical pneumonia, for example mycoplasmas and chlamydia, and against intracellular pathogens such as Legionella, some mycobacteria, including Mycobacterium tuberculosis and Mycobacterium avium complex. Moxifloxacin has modest activity against anaerobic bacteria, but lack appreciable activity against Pseudomonas aeruginosa because of toxicity when systemically administered. Gatifloxacin is available only as ophthalmic solution. لما نجي للفارماكوكينيتيك بروفايل بتاعهم after all administration كل الفلوروكوينولونز are well absorbed bioavailability ما بين 80 ل 95% and distributed widely في body fluids and tissue. The relatively long half-life of levofloxacin, gemifloxacin, and moxifloxacin permit once daily dosing. Oral administration is impaired by divalent, trivalent cations, including those cations in the antacids. Therefore, oral fluoroquinolones should be taken 2 hours before or 4 hours after any product containing these cations, even milk, because milk contains calcium and milk products. Serum concentration of intravenous administered drugs are similar to those of orally administered drugs. فالاي في ما بيفرق تماما من الاورال. most الفلوروكوينولونز ما عدا الموكسيفلوكساسين eliminated by renal mechanism, either tubular secretion or glomerular filtration. When we came to clinical uses of fluoroquinolones other than moxifloxacin, which achieve relatively low urinary level, are effective in urinary tract infections caused by many organisms including Pseudomonas aeruginosa. Bacterial effective against bacterial diarrhea caused by Shigella, Salmonella, toxogenic E. coli, and Campylobacter. Fluoroquinolones, except norfloxacin, which does not achieve adequate systemic concentration, used in infection of soft tissues, infection of bones, infection of joints, and intra-abdominal and respiratory tract infection, including those caused by multi-drug resistant organisms such as Pseudomonas and Enterobacter. Ciprofloxacin, drug of choice for prophylaxis and treatment of anthrax, معه levofloxacin. Verse effect of الquinolones fluoroquinolones most common nausea, vomiting, diarrhea, في بعض الأحيان headache, dizziness, insomnia, skin rash, and abdominal liver function test can develop. Abnormal liver function test can develop. Photosensitivity has been reported with lomifloxacin and bifloxacin. من السايد افكت لقوا انهم they prolong ال QTC interval occur mainly مع الجاتيفلوكساسين والليفوفلوكساسين والجيموفلوكساسين والموكسيفلوكساسين. عشان كده الأربعة ديل avoided or used with caution في patient with non-QTC interval prolongation أو uncorrected patient عندهم uncorrected hypokalemia أو في patient receiving class 1A أو class 3 antiarrhythmic agents أو in patient receiving other agent known to increase QTC interval زي الاريثرومايسين ده بيزيد لنا QTC interval وترايسايكليك انتي ديبريسن برضه بتزيد لنا QTC interval. Gatifloxacin has been associated with hyperglycemia in diabetic patient and with hyperglycemia in patient also receiving oral hyperglycemic agent. Thank you very much for your attention.